Hey everyone, and welcome to This Explainer. Today, we're taking a truly fascinating journey. We're going to start by looking at something highly visible and super familiar to all of us, the human tongue. But then, we're zooming all the way down into the microscopic, completely hidden world of cellular healing. It's basically a journey from the macro to the micro, exploring how the exact things causing trouble in our mouths are actively pushing the boundaries of modern regenerative medicine. Let's dive right in.
Okay, so here's our roadmap for today. First, we'll meet your amazing tongue. Then we'll look at when tongues show trouble, followed by fissures, folds, and anomalies. After that, we pivot over to the microscopic world to look at the magic inside blood, how platelets come to the rescue, and finally, tissue-guided regeneration.
Section 1. Meet your amazing tongue.
Take a look at this. Notice the sheer density and the orientation of these muscle fibers? The tongue has this incredibly intricate grid of vertical and transverse muscles crossing right over one another. And that specific structure is exactly what makes the tongue so incredibly flexible and precise. I mean, it helps us safely chew our food, it kicks off the swallowing process, it lets us articulate all the subtle nuances of speech, and of course it's ground zero for taste. It is, frankly, a biological marvel of engineering.
Section 2. When tongues show trouble. Now, because the tongue is so central to everything we do on a daily basis, it actually acts a lot like your body's check engine light. When it starts showing signs of distress, it could just mean a localized oral issue, or it might actually be waving a red flag about a much broader systemic disease. Now, the medical taxonomy for tongue disorders is massive. We can organize it into 4 neat little categories to make it digestible. First, we've got inherited, congenital, and developmental anomalies. Then, disorders of the lingual mucosa, which affect the surface covering. Third, we have disorders affecting the actual structural body of the tongue itself, like neuromuscular issues or infections. And finally, tumors of the tongue.
Section 3. Fissures, folds, and anomalies.
So let's zoom in on those inherited variations for a second and look at fissured tongue. Clinically, you might hear this called scrotal tongue or lingua dissecta. It's essentially characterized by a main anteroposterior furrow with other grooves stretching laterally right across the front surface. And here's the catch. Because of these deep folds, bacteria and food debris can get easily trapped inside those fissures. As you can imagine, that causes some pretty significant irritation or even a really uncomfortable burning sensation for the patient.
Right here, you can clearly see what I'm talking about. Those deep lateral and central longitudinal fissures going right across the tissue. Interestingly enough, this presentation is very frequently linked to genetic conditions, for instance, trisomy 21, as well as a rare neurological condition known as Milkerson-Rosenthal syndrome. For folks dealing with this, rigorous, and I mean rigorous, maintenance of oral hygiene is absolutely critical to stop that debris buildup we just mentioned.
Pivoting slightly to another major category, tumors. Notice that lesion presenting right on the lateral border here? Tumors can develop in these areas and, they can be either benign or malignant. Catching anomalies like this early on, whether it's just a minor mucosal irritation or a full-blown tumor, is exactly why we all need to pay really close attention to the visible landscape of our mouths.
Section 4. The magic inside blood.
Okay, so how does the mouth actually recover from these visible wounds? To answer that, we have to look away from the surface and dive into the invisible, microscopic components flowing right beneath it. Just look at this number, 1 trillion. That is the approximate number of brand new blood cells your body produces every single day. Your body is literally a relentless manufacturing powerhouse, just constantly refreshing the cellular workforce you need to stay alive and heal your injuries.
Now, all these newly minted cells, they're carried in blood plasma. And while plasma is overwhelmingly just water, it's that remaining 6 to 8% slice that is the real liquid gold here. It's packed with crucial proteins, prothrombin, thrombin, coagulation factors 3 through 13, and the complement system. Think of this liquid as a biological superhighway that delivers the body's best healing agents straight to an oral wound.
Section 5. Platelets to the rescue.
So who exactly is riding along that plasma superhighway? Platelets. These are tiny, enucleated cell fragments that act as your body's elite first responders. And despite lacking a nucleus, they are packed with mitochondria, microtubules, and these highly functional granules. They actually execute a super-organized 4-step tactical plan for hemostasis. First up is adhesion, where they stick to the damaged tissue. Second is activation, where they physically change shape. Third is secretion, releasing adhesive proteins and growth factors. And finally, aggregation, where they clump together to physically plug up the breach.
These specific platelet actions actually fit into a much broader timeline of tissue repair. Notice the progression here. We go from the immediate blood clot of the hemostasis phase right into the inflammatory stage where macrophages arrive. Then comes the proliferative stage where fibroblasts start rebuilding and finally remodeling. And platelets? They are the critical trigger for this entire cascade. They act as master modulators. By releasing growth factors and extracellular matrix modulators, they promote revascularization, they restore connective tissue, and they even kickstart the proliferation of mesenchymal stem cells. They are literally signaling the surrounding tissue to wake up and start rebuilding.
Section 6. Tissue-guided regeneration.
All right, so bringing all this microscopic healing power back to the mouth brings us to a really cool concept called tissue-guided regeneration. If a doctor wants to effectively regenerate lost oral tissue, say after a really severe infection like periodontitis, they need a very specific recipe. They need cells, a scaffold to act as a supporting matrix, and growth factors to act as the chemical signaling molecules. Recently, modern dentistry has started combining these exact components alongside stem cells and tissue engineering to treat some highly complex immune-inflammatory diseases.
And this leads us to what is arguably the most brilliant breakthrough of all. If we need those growth factors to stimulate cellular proliferation and healing, where is the absolute best place to get them? Well, from the patient's own platelets. By taking bioactive surgical additives derived directly from the patient's own blood, dentists can actually regulate inflammation and massively speed up the healing process, using your own biology to fix your own biology. That is a uniquely powerful, real game changer in dentistry.
So, we started today by looking at the visible anatomy of the tongue and the macro disorders that can affect it. But as we've seen, the ultimate solution to repairing those macroscopic oral diseases is actually hidden right inside us, at the microscopic level. As tissue engineering and stem cell therapies continue to advance rapidly, we really have to ask ourselves, how will continuously harnessing the targeted, regenerative power of our very own blood completely redefine the future of dental surgery? It's a pretty amazing frontier, right? Thanks for exploring this with me today on this explainer. Keep learning, and I'll catch you next time.